Hello, everybody, and welcome to today's webinar on gender-responsive social protection in crisis. This is the fourth installment in the Social Protection Approaches in Crisis series co-organized by the STAAR facility and Basic Research, exploring how, why, and when to use social protection approaches in a context of crisis. We are going to start the session right now. So I am your moderator for today. And the overview of the session is that evidence shows that crises affect men and women differently, and that women and girls and other marginalized communities are often the most hardest hit. And social protection can and should be key in building the resilience of women and girls and other marginalized communities to these shocks. But in many crisis settings, gender transformative potential of social protection is not realized. And so in today's session, drawing on research and case studies from Uganda and Haiti, our panelists will discuss the lived experiences of women and girls and other marginalized communities and the impact of shock response and social protection on these groups. So as I said earlier, this is the fourth installment in a webinar series. If you click on the little plus sign at the bottom of the page there, it will take you to more information about the series and about the webinar. The other series, the other webinars in the series are on climate resilience, fragile and conflict settings, and localization. So please do give a listen and avail yourself of those resources. I am your moderator. My name is Louisa Lippi. I am an independent consultant and a technical senior advisor with the STAAR facility and disability lead with them as well. And I'm joined by two fantastic panelists. And before we go into my introduction of them, I just want to go over some quick housekeeping rules about today's session. So this session is being recorded, and along with the presentations, it will be available on socialprotection.org and sent to all the registrants after the session. This is being conducted through Zoom, and it has an AI-generated automated captions functions. So to see the captions, please click the CC closed caption buttons at the bottom of the screen. I think it's in the More section. Please do use the chat function to introduce yourselves. Please say your name, where you're from. You can share useful links in that function as well. But the only way that you will be able to ask questions, or at least have your question asked to the panelists, is if you share it in the Q&A chat box. So again, at the bottom panel on the screen, there's a Q&A button. So please click on that. And that's really the only way that we will be able to interact with you and for you to interact with the panelists. We would also ask that you be very specific in your questions and to contextualize them. So if you have a specific question for Haiti, please say in Haiti, or if you have a specific question for Uganda, please say in Uganda. So that way we know who to direct the questions to and that the panelists have a better understanding of what you're asking. So for the flow of today's sessions, we're going to do the quick introductions of our panelists. Then we're going to go into the presentations, which will last about 20 to 30 minutes, and then followed by another 20 to 25 minutes of Q&A. And then we have 5 minutes at the end for wrap-ups and key takeaways. And so now over to our panelists. I'm very happy to be joined by our two excellent panelists, Catherine Chazaly and Caroline Holland-Szyp. Catherine is an independent social protection and humanitarian assistance expert. Her work is particularly focused in conflict-affected and fragile settings, where she provides support to governments, donors, international organizations on how to design and strengthen social protection systems with a particular emphasis on adaptive shock responsive social protection, forced displacement, gender, child responsive social protection, social inclusion, and linking humanitarian assistance and social protection. Catherine will be speaking about her research with Key Aid and STAAR that focused on the situation in Haiti. Carolina is a researcher at the Institute of Development Studies at the University of Sussex. Her research experience and interests include young people, livelihoods, social protection, social change, particularly in crisis settings, using both qualitative and participatory methods. She has worked on research projects looking on how marginalized people navigate access to social assistance in protracted crisis, social assistance for livelihoods, and climate resilience, drivers of youth engagement in violence activities, children's harmful work, and youth engagement with rural economy. Carolina will be speaking about her research with basic research in Uganda. So I will pass the floor over to Catherine to kick us off and to tell us about the research she conducted in Haiti. So over to you, Catherine.
Thank you, Louisa. Good morning, good afternoon, everybody. Thank you very much for welcoming me in this webinar. So I would like to share with you some highlights from this study that we conducted with KIED and STAAR in Haiti over the past month. The objective of the study was to look at the barriers that IDPs, internally displaced people, are facing in Haiti during the current crisis, and with a focus on women and marginalized groups, to be able to inform their inclusion into social assistance program. This study was requested by WFP, which is one of the main implementers of social assistance in Haiti. Next slide, please. Thank you. So just to give you a bit of background on the crisis, so it's a very, very fragile context, as you may know. Haiti has been kind of affected by huge violence due to gangs in urban areas. And the number of IDPs have really increased exponentially in the past year. So between the time we started, the study was launched, and the end of December, when we more or less finalized it, the number of IDPs doubled in Haiti. So it's a kind of a huge, the crisis is still there, and still actors are willing to look at how to find durable solutions for internally displaced people, especially the most vulnerable one, women and the marginalized one, through their inclusion in social assistance. Next one, please. Thank you. So one of the things that really strike us during this study, which was, as I was saying, really kind of focusing on the current situation and the impact of the violence, of the urban violence, is that there is persistent social norm, discriminatory social norms, very high risk of violence, abuse, exploitations, especially against women and marginalized groups. Widespread stigmatization, discrimination, and harassment. And this is not new. This has been documented since the crisis, the earthquake in 2010. And this is something which is continuing and which has a high impact on assistance. So despite disasters and crises being different, this is really kind of continuing and having a big impact on different aspects of assistance. Also, maybe something I need also maybe to highlight is that the study is focusing on the access to social assistance, but because social assistance programs are not really well developed, we looked at the barrier in general of accessing, assistance, humanitarian assistance and social assistance to try to inform social assistance program. So these kind of persistent discriminatory social norms have different type of impact. One is that it's really limiting the ability to understand vulnerabilities and exclusion barriers because it is so entrenched into the way people are working, and it is very difficult to have this type of analysis. And it was also a limitation of the study itself. The level of representation of women and marginalized group is very limited at all levels. in the civil society at political level, but also in the design and implementation of the programs. People have a low agency to claim rights and benefits. They do not have really information, and also they have a low agency. And also individuals are excluding themselves from assistance delivery process because of this risk of violence, very widespread violence, stigmatization, discrimination. So they are kind of excluding themselves from this process. And the process ends up being controlled by most powerful individual. Next slide, please. So just to give you an overview of the kind of current setting in Haiti and why we think, after this study that really social assistance, is really kind of have more opportunity, to tackle, this huge exclusion paradigm and really to be able to provide appropriate support, for women and marginalized groups, especially displaced people. Humanitarian assistance to IDP at the moment is concentrated in displaced sites in Port-au-Prince and Léogâne, the two kind of main urban area. It has a kind of low coverage. They are supported by a limited analysis of vulnerability and exclusion factors. As I was saying, it's not in the culture in Haiti to be able to kind of really do this detailed analysis. The humanitarian assistance is not providing response to specific needs. Transfer value are not reflecting these specific needs. And humanitarian assistance is highly dependent on humanitarian access and local partners which have higher access to the population. Social assistance in general has more opportunity to provide more appropriate assistance and also to fight exclusion. Because of course it is a multi-year assistance. It's also not only cash, but also providing accompanying measures. And design and delivery are kind of improving over time. Instruments also are more developed, in terms of communication, outreach, to be able really to reach these people, which are kind of invisible, in their community due to kind of discrimination, stigmatization, violence, etc. And there is a social registry in Haiti as well, which is becoming the entry point to social protection. However, it has a kind of limited coverage. Social assistance also in general has a limited coverage and is very much project-based. I wanted to highlight, the social assistance program, which is implemented by WFP, Claire Echimen, which is part of a wider World Bank program to strengthen social protection system in Haiti. Just to give you an idea, of the size of the program we are talking of. So there is, the program is targeting 22,000 households in only one region of Haiti, Grand Anse. It's providing cash transfer through 24 months of 40 USD, which is of course smaller than the humanitarian assistance, and is providing a top-up for some particular groups like pregnant women, people with disability, younger children, to improve human capital. And this program have been able, through its field team, which have been trained, to really kind of start tackling this issue around inclusion, because it is a multi-year program, because it has also a stronger field presence, also that training has been implemented as part of this program. It really offers, more opportunity to be able to reduce exclusion, taking more time to be able to identify and to reach to these very, very vulnerable people. Next one, please. So I just want to give you a few examples of barriers and good practice that we have been able to identify through this study. What we did is that we adapted the gender continuum framework to an inclusion continuum framework, because the study was not kind of focusing specifically on women, even if, of course, women is one of the most vulnerable and marginalized group, but it's also look, you know, at intersectional vulnerability, looking also at specific barriers, you know, that people with disability, older people, younger people could meet. Next one, please. So the study focused on design and delivery elements of humanitarian assistance and social assistance to be able, you know, to kind of extract, you know, some kind of learning, you know, from both to support the design of social assistance program that will include IDP. So in terms of the design, so as I was saying, really kind of discriminatory approach, or for example, that emergency cash assistance transfer value is not taking into account specific needs, that it has a very flat rate, which by the way also is very much below the minimum expenditure basket, which is determined for Haiti. One thing is that also eligibility conditions for humanitarian program, but also for social assistance, are very difficult to meet by marginalized people. They required an ID, an official documentation. A large part of the population do not have access to this documentation, and of course, in the case of displacement, people often lose, you know, this documentation. And in the current context in Haiti, it's very difficult to request for a new one. Also, most of the assistance is providing through cash transfer, but also communication is provided through mobile phone. So mobile phone is really mandatory, you know, to be able to be a beneficiary. And again, when you are a woman, when you are part of a marginalized group, it's very difficult to have access to a mobile phone and to keep this mobile phone when on the move. The disability list also is outdated, so some specific disability are not acknowledged. People are not trained also to be able to recognize some type of disability. So this is kind of really kind of discriminatory approach that need to be tackled. From a more neutral point of view, specific vulnerabilities and risk of exclusion are not assessed, as I was saying. It's a problem of people not being trained enough. It's also the kind of people not being aware and sensitive enough, you know, to the fact that individuals have different type of vulnerability, and also, of course, related to discrimination and stigmatization. Older people and single women are not targeted. As I was saying, there is kind of improvement at the moment in Haiti, which is through the efforts of social assistance and humanitarian response people, which are kind of doing more training, sensitizing people on gender equity and social inclusion.
Captain, sorry to interrupt, but we are getting a little short on time. So can I ask you to maybe take the next 2 minutes and wrap up?
Yes, I will. Thank you. And so, as I was saying, generally social assistance is kind of have more opportunity to be transformative by providing accompanying approach, by being able to strengthen human capital, and also by providing additional services, for example, inviting the National Identification Organization, you know, to come during delivery or different type of activities to deliver this ID, which are so important. Next slide, please. So in terms of the delivery, as you see, it's kind of quite a difficult picture. There is a lot of barriers for women and marginalized groups. The first one being, for example, that registration exercise are done only punctually and often from Monday to Friday when women are trying to, are not present, trying to be able to find resources to support their family. They're often taking place in sites, in public buildings, where people with limited mobility do not have access to. There is also physical barriers at the distribution sites for people also to be able to access the cash transfer agent. Also, sometimes the distance are very long and people do not have the financial means, to be able to pay for transfer, for transport, especially when you have kind of limited mobility. The registration is done at the household level, meaning that the individual and especially women, marginalized groups are invisible within their household, including also when you're an IDP and if the registration is done at the level of your host family. There is a lack of outreach and communication. However, there is also some kind of good practice which are developing, like especially local actors, are trying to understand the need of people, trying to adapt the way they do the delivery by kind of setting up priority lanes for women and vulnerable individuals. Also, the humanitarian actors are kind of putting together resources for complaints and feedback mechanism. Next slide, please. So just to give you a kind of overall pictures, on what we have been discussing with the actors on moving forward. There is a lot of issues, a lot of barriers. However, there is really a commitment and a willingness and an engagement from the different actors to work more together to be able to improve inclusion, knowing that, of course, there is a big issue in terms of accessing sufficient resources in Haiti at the moment. So there is kind of 3 areas that really could offer, more opportunities and also allow for putting resources together to, which is one, to improve the consultation of IDP and marginalized people. People are kind of, there is local organization that need to be better valued, capacities to be built, to be able to be a voice for these IDP and marginalized people. And they are the ones which are really being able to be present on the ground as well. And then, as I was mentioning, there is also kind of actors pulling resources together to try also to improve the quality of the different of the delivery and of the instruments, to be able to reach people, which is really kind of the main issue. It's how do you kind of reach physically to women and marginalize people to be able to register them and to provide this assistance. Thank you, Louisa. Sorry.
Thank you, Catherine. No, this is great. It was great to hear about the research and all the barriers that are in Haiti, but that there are good practices emerging and that there are opportunities to build a more inclusive social protection system. And I think that your recommendation on involving IDPs and marginalized people and better understanding their needs and requirements leads in very nicely to our next presentation from Carolina, who is going to now speak about the research she undertook in Uganda. I would like to remind people to please put their questions in the Q&A function, and you can also upvote people's questions. So if there's something that you find particularly interesting that people are also asking about, that you can upvote them and we can make sure to ask the panelists in the Q&A function. So over to Carolina. Thank you.
Thank you, Louisa. Can you hear me properly?
Yes. Yes.
Okay. Hi, everyone. It's great to be here, and thanks Catherine for a really great overview of IDP's experiences with social assistance in Haiti. Today, I'm excited to share insights from the Basic Research Lived Experiences project. I'll be presenting our work, which focus on marginalized people's experiences with social assistance during crisis on behalf of our whole team. We conducted research in 2 countries, Kurdistan region of Iraq and Uganda. And today I'll be focusing on our Uganda case study, which I've worked on. And this was led by IDS and our local partners, Rural Development Research and Training Consulting Agency from TESO. I will give you a quick snapshot of our approach and key findings, and please keep an eye out for the links in the chat to the resources that we produced. Next slide, please. So let me give you some context about our research. This is part of an FCDO-funded 5-year program led by IDS, looking at social assistance in protracted crisis. We have around 20 projects across different themes, but the focus of this particular project has been really people-centered. We had 2 main objectives. First was to understand how marginalized people navigate social assistance, these being mainly social transfers, including cash, in-kind, and vouchers, in challenging contexts, like places affected by conflicts, displacement, and climate shocks. And second, to use these insights to figure out how more inclusive and effective support systems can be built. The Uganda context is quite complex. We're talking about decades of conflict, massive internal displacement, recurring climate shocks, and ongoing socioeconomic and political challenges, including limited and inadequate access to social protection. In places like Teso and Karamoja, which is where our research took place in, people have been living through multiple crises that continuously reshape their life. For widows, single mothers, older and disabled people, these challenges have been very intense. Gender norms, cultural practices, polygamy, lack of support, and persistent discrimination and stigma have created additional layers of vulnerability for them. Next slide, please. So what did we do to capture their experiences? Our methodology was all about participation and collaboration. We didn't just swoop in as external researchers, we trained the local research team and peer researchers who actually come from the communities we were studying and face some of the intersecting inequalities that we were focusing on. This meant that our research was grounded in real lived experiences. We trained them in the participatory research approach and methods, documentation, translation, and different support roles, and they collect the data collection. This actually helped build trust and made sure that the process was meaningful to the participants themselves. We focused on 3 groups: people with disabilities, widows and single mothers, and older people. In total, 33, including peer researchers amongst them. We used a mix of methods throughout time, which included narrative interviews, visual techniques, participatory group discussions, collective analysis. You can see many of these examples on the screen right now, always aiming to keep our participants' needs and comfort at the center of it. The goal wasn't just to extract information, but to create a supportive space where people could share their stories. And these approaches allow their participants to share details that might have been harder to express in a traditional interview setting. A key highlight was bringing 30 people together in a cross-stakeholder dialogue where participants directly presented their work in the project and their recommendations to social assistance providers. This was a key part of making the research actionable. We generated nearly 100 transcripts and 20 project reports, which wasn't just about research, it was also about empowering participants to explore their own experiences and creating bottom-up pathways for better assistance. And in some cases, this led to real shifts in how social assistance providers engage with these marginalized groups. Next slide, please. So where did participants actually get social assistance from? 2/3 of them reporting having received some form of support at some point. But this wasn't just about government or NGO schemes. People actually relied on friends and family, neighbors, churches, and even individual philanthropists and well-wishers. These kinds of informal or semi-formal support networks, they were often based on personal relationships and trust rather than necessarily official eligibility criteria. One thing stood out: recurrent support was quite rare, except for the older people that were receiving the SAGE social pension. This is a government-provided social pension for elderly people, and some participants with disabilities who received help from NGOs or individuals with education fees. For most others, the support was one-off. Things like small amounts of cash, food, some essential items, or even services such as housing or shelter. And this mainly came from non-state providers. Next one, please. Thanks. So what have we found? We found that social assistance in protracted crisis is failing the most marginalized. People like widows, single mothers, older people, and persons with disabilities in Uganda are already facing deep and intersecting inequalities. Conflict and displacement and climate shocks have only made things worse for them, pushing them into even greater hardship when social assistance is often temporary and inadequate and unreliable. You will see on the screen here some selected quotes from participants that illustrate these points. And these stories here show how people are often pushed into precarious situations. Sometimes they end up spending what little they have just to try to access social assistance, for example, on transport or paperwork or even bribes, without any guarantee they'll actually receive help. Many relied instead on their informal networks, as I said, relatives, neighbors, religious groups, or one-off political donations to get by. Others turned to subsistence farming or risky coping strategies like hazardous manual labor, begging, or even eating waste. The thing is, for most of them, the lack of meaningful and long-term measures may have enabled their survival, but often kept them in this cycle of need. Next slide, please. And the challenges that they face go beyond just insufficient aid. We actually discover some deeply problematic and exclusionary practices that make accessing help not just difficult for them, but also potentially dangerous. We have seen many reporting risks and barriers when trying to access support. These included from bureaucratic red tape to outright discrimination and corruption. Some reported were being pushed out of the system entirely, while others have faced unsafe and humiliating conditions just to receive minimal aid. So while some of them were excluded or self-excluded, as Catherine also reported having happened in Haiti, others were adversely included in this case. So here, adverse inclusion, we draw the attention to how participants had to face unacceptable conditions in social assistance processes to survive. Women, especially single mothers, share stories of sexual harassment and exploitation, having to choose between rejecting this and being denied support altogether. For elderly and disabled people, the process was often so complicated and frustrating that they often felt that they had to give up. The stigma of needing help and the experience of seeking assistance added another layer of stress for them and could be humiliating. People with disabilities, for instance, were sometimes told to stand aside, only to be ignored entirely and disrespected afterwards. Food distribution points, crowds often became dangerous, with the weak getting pushed aside and trampled on. Corruption, like bribes, favoritism, and political or religious biases illustrated the existing power dynamics in that context that further marginalized them and fueled their frustration and mistrust and despair. This meant that
I'm sorry, Carolina, but can I give you another 2 minutes just to wrap up?
No problem.
Thank you.
So this meant that social assistance, that when social assistance was unpredictable and unfair, it have had negative material, physical, but also emotional impacts for our participants. Next slide, please. I'll try to go quickly, but this is something interesting. Despite these structural barriers, people have shown some agency. They show how there were not just passive victims or only vulnerable people waiting to be helped, but they navigated complex systems whilst balancing safety, dignity, and survival. They made decisions about who to turn to for help, how to present themselves, and when to step back. These stories here that you can see on the screen reveal some of the strategies that marginalized people use, such as building and cultivating their social networks, tolerating certain situations by making trade-offs, strategically presenting themselves as people deserving of help, waiting, diversifying, and sometimes actively resisting or avoiding harmful practices. These strategies have shown how resilient and their agency, how that existed, but they also highlighted how flawed the system is, putting themselves in those situations where they had to navigate a landscape full of trade-offs and risks just to get the help that they needed or that which was available. And this is my last slide. Our approach and our research ultimately points to a way forward, which is participatory approaches. These are not just about collecting data, they're about creating genuine and respectful dialogue. Participatory research in our study gave marginalized people a chance to share their experiences, highlight hidden challenges, and contribute to shaping solutions. It also helped create a sense of collective agency and accountability, bringing different stakeholders together to improve support systems. And these approaches, participatory approaches, can be accessible to anyone and can be longer term, can go beyond improving just immediate aid. They can contribute to restoring dignity, building trust, and creating spaces for marginalized people to be heard and to lead the change that responds to their own experiences. Next, please. Thank you. Next slide, please. Thank you. Oh, you're muted, Louisa.
There you go. Thank you so much, Carolina, for your presentation. It was excellent, and I do encourage people to read the paper, which is just recently out, and I believe it was shared in the chat function. It's a really interesting paper, and it's a really important piece of research in terms of getting at people's real experiences and how better we can, as practitioners, try to incorporate those experiences into design programs. Because often we think about things only from the system side, and so it's really nice to understand things from the participant side. So we're going to open up for questions. I know Catherine had answered some of the questions that were posed to her in the chat. There were two that were posed to Catherine. One was on how systems can help people to access identity papers, especially in situations of forced displacement, because losing those papers is a common experience, and we know that that's a big barrier to accessing support. And so just to recap, so she did mention that there's partnerships with other civil registration authorities to try to facilitate the access to IDs. I don't know, Catherine, if you want to expand on that any more than what you have already put in the chat.
Yeah, this was really a good practice that came out from the organization in Haiti. The fact to invite the authorities which are delivering the ID to the registration or distribution, to the activities of the program. It kind of reduces the physical barrier. Also, sometimes people have to pay some specific fees, which may not be official. And so the organization is kind of supporting, to make the link between the person and the authorities. However, it has a cost. And I think in general, also what we see is that kind of fighting the barriers of exclusion has a cost, being able to reach people out, to do registration, which will kind of go, to find the individuals which are hidden inside their family, which are invisible, etc. This has a cost. And that's why also it's so important for organizations to be able to work together, to pool resources together, to have also humanitarian actors supporting social assistance people, with these different steps, in terms of communication, etc. Because really it has a cost, and at the moment resources are also going down. So
Great. I just wanted to reflect a little bit on both of your presentations. In both the Uganda and Haiti situation, it seems that the limitations of the social protection system, of course, were emphasized and really came into the light in these different crisis contexts, where the limitations really prevented the systems from providing a rapid and coherent responses. So I wonder if both Carolina and Catherine, maybe if you can talk a little bit more about how the delivery of the limited delivery of social assistance in both of those countries, how the institutional setup affected the delivery, and especially to marginalized groups. So really, when you're thinking about a social assistance system, we generally want to look at one that comes that provides a floor, one that covers the life cycle, that's able to respond to different marginalized groups when the crisis hits. But in both situations, they seemed quite limited on either the geographic location or the target. So it'd be interesting to hear maybe a little bit more from your perspectives about how those institutional setups affected the delivery.
Should I go first? Thank you. Yeah, I think in Uganda, one of the programs that came up with our participants was the SAGE program, the social pension provided by the government, main formal social protection program. But it became clear that the design of it severely limited who receives the help, who receives the support, the cash, including during the shocks and crises. So SAGE supports older people, but mainly those above 80 years old at the moment. This created what some of our participants called arbitrary exclusion. Older adults told us that the cut-off, this age cut-off, felt deeply unfair. Many were struggling in that context well before they were 80 and had to wait years, if not decades, before qualifying. These narrow criteria left, in many situations, highly vulnerable populations who haven't reached the 80 in these locations with no stable support from the government. These excluded groups then relied on or turned to a complex patchwork of support provided by NGOs, by religious organizations, by community groups, and just, whoever they could gain access to. And this created multiple issues reported by them. This assistance was typically provided as a one-off rather than a regular basis, making planning for them quite tricky. It was also unpredictable. Participants described weeks, months of waiting for something that was promised by a certain date. It usually was insufficient, very small pieces of assistance. I think one of the quotes that I showed discussed an older man in an IDP camp receiving just 1 cup of food for him and for his whole family. So providing minimal support that doesn't match people's needs, and access depending heavily, as I said, on their social networks. And the reality is that the marginalized people have to navigate these fragmented systems that have their own gatekeepers, their own power dynamics, and creating openings for corruptions and other risks. So responding to your question, strong and inclusive formal systems from the start that reach beyond these narrow categories are crucial, including for shock and crisis response. And when there are significant gaps already, the most marginalized often can fall through the cracks, facing these additional risks that I was discussing. I hope that answers.
Yes, thank you so much. I wanted to ask Catherine a little bit about the experience in Haiti and with the vulnerability analysis, maybe in Haiti and specifically, but in maybe you could reflect on it more generally as well, that a lot of times vulnerability analysis in humanitarian responses largely becomes about counting who is vulnerable, and usually by adopting some type of generic categories and then identifying those people who meet the criteria, with really little attention being paid to the larger processes that put people at particular risks. And I just wonder if you can reflect a little bit about how vulnerability analysis can be improved within a humanitarian assistance operation, really to try not to address the immediate needs, like what Carolina was talking about, giving some cup of food now and again, but really trying to address some of these underlying issues so that we are building resilience and having a more sustainable impact.
Yeah, thank you, Louisa. As I was saying, in Haiti, the situation is quite complex because you have this kind of very deep, social norms, and this culture of stigmatization, discrimination, which make that even, organizations which are providing assistance, tend to see people, as having all the kind of same needs, the same kind of level of vulnerabilities, etc. So it's really kind of requires efforts, in terms of reinforcing the capacities of the organization. However, you have, specialized organization. You have also local organization which have been working since a long time, with women, marginalized groups. And what is happening, it's also due to resources and due also to the ongoing violence. But there is much more that could be done in valuing their capacities and their ability to be able to conduct this specific vulnerability assessment, to really be able to highlight to the needs of people. There is some kind of reports as well, which have been done, some kind of assessment which have been done over the years. And I was quite surprised, in fact, when I started this work, I've been working in Haiti before, that the evidence, are there, but they are not also always disseminated. So definitely, when I was mentioning the need, to consult people, I think really there is a need, to kind of really be more proactive in putting this local organization, specialized organization, at the forefront, sharing evidence and really kind of allowing them, to be a voice, for the marginalized groups. And this also requires resources, and also required to adopt a do no not harm, also approach, because these organizations are on the ground, and of course they could be also targeted, by the kind of by violence and by some specific groups and group of interest, etc. So it's required a kind of careful, approach, but it's possible, and some organizations are already doing it. So.
Myself. I think that leads us nice into a question that we have in the chat from Helene, specifically to Carolina, I'm sorry, asking if you could please elaborate a bit more on the participatory approaches you adopted and the extent to which it was helpful to build trust, but also gain insights that we don't normally hear.
Yes, of course. Thanks for the question. So I would say that the whole premise of this project was built on allowing the necessary time for this trust and confidence to be developed by participants. And yeah, obviously these require resources. We first started with a training session for the local research partners and peer researchers that allowed everyone to get on the same page and understand what we're aiming for with the research project. Then we stayed for a bit for a 4-day workshop with one of the groups, with a group of people with disabilities, where the peer researchers started doing the research, leading the research processes themselves after that training session where IDS and the local research partners led the research with them. So that was kind of allowing trust, but also to develop, but also their confidence on their own capacities, and trying and seeing what worked and seeing what didn't work. So storytelling was a method that we use story prompts, and they tried a story, and sometimes they just talked for like 1 minute, and then we said, well, let's try again. Let's see, like let's see what other prompt can work. Other prompt can work better to get to the, and then people became more aware of what kind of detail was interesting to get to. So in terms of the methods, yes, a key thing, crucial thing is time, patience, and also getting to know each other. People that that were working in a similar group across some of the many months, on and off. So they already knew each other, and they slowly became more and more comfortable about talking to issues that were particularly sensitive, or that they might have been ashamed about if we just turned up and did a 1-hour interview with them. We probably wouldn't have got to those kind of issues. So the issues about young single mothers or women in facing sexual harassment only came like way down the line in the process. It was not something that came up at the beginning. So yes, I would say key things for trust was time and resources, because some of these people also, the group of disabilities, we had to support not just them, but also people that might have like resources for people accompanying them and supporting them, extra things that they might need to take part in this research. And yes, allowing and facilitating these safe environments to share. And that was part of the training, and the peer researchers became like so excellent at doing this themselves. It was just, yeah, it was a great process, and I think, yeah, it was different to doing interviews for sure.
Great. There were 2 other questions in the Q&A box. I don't think we'll have quite time to cover them both. One was on your experience, just in terms of your career experience. Are life cycle social protection programs better at reaching the most vulnerable and excluded segments of the population, as opposed to proxy means driven poverty targeted social protection programs? So just your reflections on that. And then there was another question on if there's linkages between informal employment and reach. Usually those informally employed and invisible are not captured in the data, yet they make up a huge part of the labor force, especially in developing countries. Women are more likely to be working informally, and is there a push for them to become incorporated formally and thus gain access to social protection labor rights? And thanking you both for both your presentations and research. So unfortunately, we don't have time. We're just at the last 2 minutes, so we do need to wrap up. But I do think that when we do look at poverty targeting programs, kind of looking at both questions together, they do tend to look at people who can't work or who have very low incomes and low assets. And so usually those types of programs do exclude indirectly people who are informally employed, who may have access to some type of employment and who have higher assets. So I think there is that type of exclusion when it comes to formal employment, and women particularly, who are of course involved heavily in formal employment. And just I think that we need to start looking at these more life cycle approaches to social protection, that we need to start putting in more, these are just my key takeaways and wrap-up points, that we need to start strengthening social protection systems from the start to make them more inclusive. We need to take a more rights-based approach, a more life cycle approach to establish social protection floors to ensure that people are being included. And we know that a lot of times poverty targeted programs, proxy means testing programs, they don't capture the dynamic reality of people's lived lives. they take a snapshot of one time when they do the census, and they're not able to respond when crisis hits to these fluctuations that people have. So strengthening the life cycle approach and the system from that perspective before the crisis hits is really essential to ensuring that we have a more inclusive response through our social protection systems. And I think just lastly, from the two presentations, I think there is a clear call to invest more in a greater understanding of vulnerability and needs, to directly consult with the program participants, either those who are actually benefiting from the program or who may be eligible, just to understand what are the barriers, what are their needs, to really get a better sense of the lived experience. And as Carolina was saying, do it maybe on a longer term, not just a one-off survey now and again, but try to establish some trust and connections with the people. So you're really getting at some of those issues that we normally don't talk about. And in that way, then we're better able to design responses to meet their needs. So I want to thank both Catherine and Carolina for their excellent presentations and taking the time to be with us today. And I want to extend a thanks to all of you who also took the time to join us today. All the materials again will be sent to you through email and will be uploaded onto socialprotection.org. So please have a look and have a look at the blog that Catherine has written on Haiti, and then the full paper, as well as the blog or the briefing piece that Carolina has and her team have written on Uganda. And then you can also look at the work that they've done, the similar work that they've done in Iraq. So thank you very much. Enjoy the rest of your day, and goodbye.
Thanks, Louisa and
Thank you,
Catherine.
Louisa. Thank you, Carolina.
Thank you, everyone.